Second session, it was in 1/8/2024. The wound size reduced to 20 multiply 11 centimeter. 5 days after second session, the wound, we significant reduction in size overall. Third session, this is 3rd of September 2024. The wound size measure is 16 multiply 7 centimeter. Fourth session, in 25 of September, the wound reduction also in the size is 11 multiply 7 centimeter. The last update is 15/10 of 2024. The wound measure is 9 multiply 2. Nowadays, mashallah, is close. For conclusion, the utilization of the DermaGold device has shown positive impact on the healing process of diabetic foot ulcer in this patient. The significant improvement observed in the relatively short period and supported device effectiveness in enhancing wound healing. Continue monitoring and holistic approach to managing patient diabetes are recommended to optimize future outcomes. Okay, this is another technology, but still, inshallah, we plan to use it. This is the amniotic membrane. The amniotic membrane is one of the fetal membrane which is produced by penetrated and procedure of the immune. Okay, this is like a sheet. It shows the result of reduction of healing time and reduction in patient suffering to avoid amputation. For the effective of the biological this dressing is synthesis of the growth factor like cytokinase or repetition of the process. The effect of this technology or this amniotic membrane we show during the healing process. You will see in the bleeding, inflammation, proliferation, and remodeling. For the inflammatory effect, we will show the most significant inflammatory effect by disperse interleukin 10. It can be show there is more significant inflammatory effect by inhibitor metalloproteinase. About the epithelial effect or angiogenic, we will show there is dispersed in the wound many angiogenic factor like growth factor. Okay, it more affect inflammatory effect. There is angiogenic epithelial effect. Mechanical effect means is reduce the dryness of the wound, reduction of the scar, and also analgesic effect is reduce the pain. This is one case already use they using the amniotic derm 4 times. Starting, after 4 applications until to closure. Okay, another technology is the 4D bioprinting. The 4D bioprinting, simply, I will show you here. If there is skin injury, before there is using the 2D skin repair, using the growth factor and cells, then inject to the wound. They are developed and using and add hydrogel. It's called the 3D skin repair. We more improving and using the another 4 skin repair, automizing with skin graft. Until you are using, you make it like with a machine, like mimic tissue. and implant this tissue in the injury or in the wound. This tissue or this graft, it enhancing the healing process or growth factors until reach to the wound healing. This is show you are using. I will show you using the adipose tissue or fatty tissue to treat our regeneration. We use here adipose tissue to make one graft by adipose tissue and implant in the diabetic foot. We are starting by micronizing the step. This is like prepare the adipose tissue, fat, and mixing with normal saline. Then using the gravity to separate between the fat and the blood, and using that fat and inject. Put it in the machine to make this grafting and put it and implant in the wound. Here, the same. Just take the picture and sizes from the wound. This take initial, then make micronize adipose tissue, make the graft, implant this graft to the wound, and monitoring the apply. But no need to do suturing or something. Just implant, cover. This is case using also until the closure. Another case use the same technologist. The fourth technology you can use the platelet-rich plasma. This is strategy. What is the mean? Is mixture of concentrated platelet, include cytokinase, growth factor, and anti-inflammatory properties. What this technology do? Stimulate the healing process. It can also inject during the surgical process and augmented healing and speed recovery. This technology, before you are using, take sample from you, blood sample from you, and take that platelet and direct inject to the site of injury to enhancing the healing process with growth factor. Yani simply here shown the picture. Take blood sample from you, do this preparation and separation, use the platelet rich with the plasma, then put it and inject it in the wound site. Okay. This is extracellular matrix. This one of the large network of protein and other molecules that surround and support and give the structure to the cell and tissue in the body. Extracellular matrix help to the cell to attach and communicate with nearby cells and play the important role in cell growth and movement and other cell function. This is another one technology. It's called atmospheric plasma therapy. Here in this technology, we are using plasma, cold plasma, compromise reactive with oxygen and nitrogen. What is the more actions? Actions beside the growth factor will healing process, it targeted to against bacterial interactive and improve wound healing. Last technology, you know about, you are dealing with the negative pressure, right? The negative pressure is one technique with facilitated wound treatment, utilize subatmospheric pressure. It consists of placing in the open cell wound interference, Lexar sponge goes directly to the wound surface. Yani machine is doing the vacuum. By what? By sponge. This is sponge will adhere in the wound and do back to the fluid and exudate of that wound. Okay, how this works? How the negative pressure work? Provide a closed and moist wound healing environment decrease the wound volume, remove the excess fluid that can inhibit the wound healing, help to remove the interstitial fluid, promote granulation. Indication: most use of the negative pressure, huge, clean, and exudative wound while waiting for distinctive wound closure, fixation of the skin graft. We can use it with the skin graft to enhance and increase more fixations. What is the contraindication of this therapy? Cannot be used with this clotting, this factor. If there is necrotic wound, bed, or the scar, we need to do debridement before using this technique. Untreated infection and new plastic tissue. This is new plastic tissue is one of the non-healable wound, not recommended to use negative pressure. Here they are show you during this technique how much the pressure you can use and suitable depend of the case. If you are apply or indication to using this therapy. If you have patient need with a graft, use the low pressure. If the patient with acute wound pressure ulcer, use the 125. This is dependent what is the doctor, this is doctor order, and he decide how much pressure they will apply. For the chronic wound, you can start it with, especially with venous or arterial insufficiency, you can use with 50 to 75. Even this therapy need to change from 3 to 5 days. This is my reference. Thank you. Any question?
Thank you, Ms. Ala. It was very informative information. Ms. Ala, she came from MOH, and they are working on the training for the wound care. The goal is 500 nursing of wound care this year to teach them. Yes, there we go. So from yesterday until today, we are in this journey for to learn more about the wound. Today we have with us also our consultant, Dr. Abdullah Sheikhi. He's a plastic consultant in our hospital. Please welcome Dr. Abdullah.
Yeah, it's okay. Shukran, Arwa. Thank you, everybody. Good morning. Assalamu alaikum. في سلك كده wound care طبعا it's a very complex process. It involves many specialities, it involves many disciplines, and like the speaker before me, the cost involved in wound care is huge. Whether we talk about burns, traumas, we talk about pressure ulcers and all that, billions and billions of dollars. I have one message to everybody here. There is the message, one size doesn't fit all. You always need to. طبعا احنا في خضم، this is عربية ما أعرف كيف ترجمتها، في خضم the huge number of products in the market, right? And the companies they compete, but we don't compete. What we do is we see what is better for each case, and that's what's good, when, like nurses, doctors, technicians, and all that, we have the ability to combine different products from different companies, and that's the beauty of it. You can develop more because you can use more products and different products. But my talk it's okay. I have it. I can start. So my talk was I know a lot of previous talks people presented about healing and all that. Maybe presented before me, added a few things about multiple modalities. I'll focus on two things. The first one is what we do as surgeons to help you care for the wound. So forget about the dressing and all that, the surgery part of it. Just give you a little bit of an outline how we perform surgeries and how do we choose the right procedure. The second talk, I'll talk about PRP a little bit more in details because it's very important. The PRP, platelet-rich plasma, presented before me mentioned it a little bit, but it's a good thing to know and maybe even start to apply. Let me ask a question with raised hands. Any of you have actually did PRP and apply in caring for wounds, platelet-rich plasma? Do you know how to do the technique and how to apply it?
I think they are not using it in government hospitals.
Sorry?
Private hospitals.
I'm not talking about private hospitals. طبعا PRP used in cosmetic centers a lot and all that, but in wound care, it's a very good modality. It's easy to use, but the way you incorporate it, and these are the problems we face, you and us, when we try to choose how to care for the wound or how to care for the patient. You have the famous triangle in healthcare is cost, quality, and efficiency, right? So you're always controlled by these measures. You cannot just do whatever you want. Anyways, wound closure. So when we face a wound, patient comes to the clinic or in the emergency department, whatever, and he has a chronic wound. We labeled him a chronic wound already. We could use a lot of modalities, but at the end, if the wound doesn't close, you need to close it surgically. And the method you do will depend on how did it happen? Okay. So yeah, mechanism of wound healing we'll touch briefly because everybody spoke about this for sure. Chronic wounds and options for wound closure. That's going to be my focus, plus a little bit of PRP. So this is, you all know, everybody talked about it. The point is important tell hemostasis. Why platelet is important in healing, and why we think it's a great modality, because wound healing starts with hemostasis. That's your first step, which is coagulation. Whenever an injury happens in the body, the platelet will aggregate. That's the first thing they do, and then a process called platelet activation happens at the site of the wound to produce the clot, to stop the bleeding first, which is the hemostasis, and then hemostasis will lead to the steps before. And platelets is found everywhere in the hemostasis. From physiology, hemostasis we will remember intrinsic, extrinsic factors, and after hemostasis, inflammation will happen, and then that's where the platelet produce most of the growth factors you just talked about. There are like now maybe and cytokines. When we started medical school some time ago, كانوا cytokines واصلين يمكن 10 أو شيء. الآن in the tens, I don't know, 50 cytokines موجودة في البادي يعني. They were there, but nobody discovered them. So, as I said, we're going to talk mainly about wound closure, what the techniques available, and explain to you how we do it, the concept, and assess the patient factors. You always go back to the patients. That's why we said one size doesn't fit all. Even one surgery does not fit all. Yeah, this patient might need flap, this patient might need a skin graft, and so on and so forth. So this is a famous thing for surgeons, but I thought you guys need to know about it. Reconstructive bladder, that's the way we think when we see a patient with a defect. A defect is a wound or post-cancer resection or whatever. We think from simple to more complex procedures. And I think this is the way you think too when you see a patient for wound care, right? You start from simple, cheaper to advanced and expensive. So we do secondary intention. Secondary intention is just leave the wound. That's the first thing. And if it's a small wound, you leave it, it will heal by scarring, right? It will form a scar and will close. بعدين next stage is primary closure. You know, if you needed to, in the emergency department or the operating room, you just close the wound. You have no more wound. Then you go into skin grafts. That's the step before, after. Local tissue rearrangement. This means it's local flaps. When we say flap, is a piece of tissue that's supplied by a blood vessel, and you can move it around in a way to close the defect. That's a flap. Regional flap is bigger than the local flap. So let's say, مثلا, if you talk about local flap, it's a skin flap in the chest. You move it, whether a Z-plasty or many geometrical way. The regional flap will be the whole pectoralis muscle. So you move the whole pectoralis muscle to cover a defect. A defect here, you move it, cover it here, whatever. So that's the difference between local and regional flap. Then the free tissue transfer, which is you take a piece from somewhere and you plug another defect somewhere else. And the goal is always to provide a structured plan, minimizing complexity. Try to make it as simple as you can in everything we do, whether, as I said, surgery or even wound care. طبعا this is the general concept اللي هو reconstruction ladder. But now, with all what's happening, like we said, technology is advancing, whether wound care, whether surgery, and we cannot just keep doing the same. Now we talk about a reconstructive elevator. So there are modern techniques. It doesn't fit in the ladder that I just talked about. Now we have all these things like you just talked about: negative pressure, dermal substitute, tissue expansion, perforator flaps, dressing, different technologies. They now we have to fit them in our thinking and maybe change the way we do things, and not just say, well, I have a wound, first thing I think primary closure. If I can't, I do skin graft right away. No. Now there are a lot of technologies that might help us to and call it a reconstructive elevator instead of a ladder. So you just go up right away to the top. And that's what we're doing. And it all depends on the wound and on the patient, logistics, cost. These things are important. So negative pressure, I'm not going to talk, you all know about it. Huh? So it's one addition that we use a lot now. This negative pressure has revolutionized the way we do things. I tell you, out of 10 patients, we will do 9 flaps in the past, or 9 skin grafts. Now, 1 flap, 1 skin graft, because of negative pressure and the way it revolutionized the wound, It makes the wound, instead of needing a flap, maybe need a small closure or just a graft. Dermal substitutes, you guys know dermal substitutes? What are they? Generally, dermal substitutes are material that we add to the wound, because the wound, when we define a wound, the wound is a loss of the tissue, the layers. Right? So you lose the epidermis, you lose the dermis, you lose the fat, and depending on how, to go full thickness. And whenever you do a repair, let's say you do a skin graft is only epidermis, for example. So you don't have the layers to cover the. So now a lot of technologies in the market, some of them are here with us in the companies. We add material that helps us do the skin graft or help heal the wound through the dermal substitutes. There are many types. Natural biologic, some of them are biologic, like when we say biologic, it means it comes from either human or animals, but it's not processed, it's really biologic, it's natural. Like allograft. Allograft is, we use in burns patient. Allograft is like, we take from cadaveric skin from donors, human cadaveric.